Hello, I am Dr. Ramani CV, consultant plastic, cosmetic and reconstructive surgeon working at Manipal Hospitals, Whitefield. Replantation surgery basically means restoring life to a lifeless extremity or any organ, and it involves a surgery wherein we reattach the amputated or the severed part, be it a finger, upper extremity, lower extremity or any other part of the body, and attach the blood vessels to establish the inflow and the outflow of the blood. And finally our aim is to restore the normal form, function of the amputated part. So basically for any kind of replant surgery, it is a technically demanding surgery for a plastic and a microsurgeon. And so whenever the patient comes to the hospital, we ask for how did the injury happen or the mechanism of injury, so that we know that the underlying structures are not damaged by the what is the extent of damage. That is what we want to assess, whether it was a crush or whether it was a clean cut. So we want to know what was the mechanism of injury and what is their hand dominance, whether they are a right hand dominant person or a left hand dominant person. And then we get an x-ray of both the hands if a finger is going to get replanted, and make sure that the level at which the bone is cut is identified in the x-ray. And we don't shorten the stump of the amputated extremity, and we try to maintain the length, and that is our main goal. So once this is done, the amputated part, which is properly preserved, is taken to the operating theatre as early as possible, and it is examined under a microscope, and we try to identify all the important structures, the artery, vein, nerve, tendon, everything, and all the structures are reassessed for any injury, and we will see for the possibility of a replant or no. And once the structures are identified, they are tagged with the suture material so that later they can be sutured back. So this is the first part. The second part comes when the patient gets shifted to the operation theatre, and we don't waste time, because until the patient is shifted to the theatre, the amputated part is already taken to the operating theatre, and we work on. So that is called as a bench surgery. So once the patient comes to the theatre under anesthesia, the amputated stump area is examined again under the microscope, and all the structures are examined and they are cleaned, and whatever contamination is there, all that is removed, and any skin which is non-viable is removed. And then we see for the arterial inflow. We release the clamp from the artery and we see how good the flow is from the artery, and if the flow is good and all the structures are repairable, then it follows a correct sequence wherein we fix the bone first and then repair the tendons. And some people do the artery first if the ischemia time is long, and some people prefer to do the veins first, so that after the artery is done, the vein gets filled up. So the sequence differs in each of the center. So you have to do the artery or the vein, both you can do, and then the nerves are repaired to provide the sensation. So once the surgery is done, patient is put on a protective splint, and the hand is kept in an elevated position to prevent any edema. So the main part of this whole exercise is the transportation of the amputated part or an extremity. So it all depends how well the amputated part is brought to the hospital. So people have to be aware that whenever there is an accident like this, either at the site of work site because of a machinery injury or an accidental injury at home, if a finger is amputated, they need to put it in a plastic container and then in a bag of ice. The finger should not be in direct contact with ice or water. This is to prevent any kind of cell death. So once this is done, the bag is sealed and then brought directly to the hospital. And coming to the amputated hand or the stump area, if at all they are going to a local hospital to stop the bleeding, there should be only an occlusive dressing, They should, the hospital, minor or a local hospital, they should not try to stop the bleeding by applying any kind of an instrument on the bleeding vessel, because this will damage the blood vessel and we will not have enough length for us to repair the amputated part. So this is what is main, and people should be aware that the part has to be transported properly, and as early as it is transported, we can give a better success rate for the finger replant. Up to 12 hours of cold ischemia time and up to 6 hours of warm ischemia time is what is considered as a standard for any kind of finger replant. And as the amputation level progresses proximally and more amount of muscle is involved, the replantation time becomes very short. So if a part is properly preserved and brought to the hospital, then that is what is called as the cold ischemia time. So the time between the time at which the amputation has happened and the time to re-establish the blood flow is the ischemia time. So if the part is properly preserved, then we call it as a cold ischemia time, and if the part is not properly preserved without any ice, then it is called as a warm ischemia time. So in a finger, 6 hours is a maximum time for a warm ischemia, and if the part is properly preserved, then even 12 hours, up to 12 hours of cold ischemia time is possible for us to reattach the finger. Well, it is natural for the patient and the operating surgeon to expect a very natural outcome, that is a successful outcome, being the finger which is amputated becoming normal both in terms of form and function. But it requires the operating surgeon to examine both the amputated part and the stump under an operating microscope to see for the feasibility of a replant. And definitely our aim is to maintain the normal form, function, and as well as the sensation of the finger which is amputated. In a trauma which involves a finger, and if there is an amputation of the finger at multiple levels, or a kind of machinery injury where there is segmental amputation of the finger or multiple fingers, or of the upper or the lower extremity at various levels, and if it involves a lot of degloving of the skin and crushing and tissue damage, then the chances of successful replant reduces. And there is another specific kind of amputation which is called as avulsion injury amputation, in which the extent of damage goes well beyond the external level of damage, that is the artery and the veins and nerves are injured well beyond the level of amputation. So here also the chances of successful outcome are very less. So an ideal scenario for a successful replant would be a clean cut amputation, and in which all the structures right from the skin, artery, nerve, vein, everything is cut, and the structures are not damaged. So it is basically to clean up the edges of the wound and then re-establish the blood flow so as to have a successful replant. Any extremity or a finger which is reattached, the main aim of the replant is to give back what was normal. So our aim is to give back the form, function, and the sensation of the finger or the amputated part. So the patient will be able to definitely carry out the normal activities, and the only thing which needs to be done after the surgery, after the successful replant, is to undergo a proper physiotherapy. Whenever a replant is done, the first aim is to re-establish the blood flow, both the inflow, that is the arterial flow, and the outflow, which is the venous flow, and then is to give it a structural integrity by which we fix the bone. So that gives the stability to the amputated part, and we also reattach the tendons which move the fingers. Okay, so there is a balance between the movement of the fingers. So finally, when the patient undergoes a proper training of physiotherapy for a minimum of 4 weeks, then the patient will be able to do all the fine works using his thumb, index, mid finger, which is basically used to pinch any small objects and even to lift weights. Since finger replantation or any extremity replantation is a highly technically demanding surgery, you need to have a proper infrastructure in the hospital where you are doing such surgeries, right from the emergency room where the patient is being resuscitated and the amputated part being taken care of, patient general condition being taken care of, and then in the hospital, in the operation theatre, you should have an operating microscope, which is an absolute necessity for doing such a procedure, and the instruments which we use to reattach the blood vessels are all very fine instruments called as the micro instruments, and the suture material or the stitch material which we use to reattach the blood vessels are very fine thread. So you have to have magnification under the microscope to see these suture materials and stitch back the blood vessels. Basically, for any kind of replantation to be done, it requires a team, and the whole team should be aware of the start to the end, that is the surgical steps involved in doing a replantation, right from the emergency physician, the operating surgeon and his assistant, and the anesthetist, the staff who assist for the case. Everybody should know what are the steps involved in a replantation, because time is a crucial factor in replantation. So nowhere we should be wasting time in doing the replantation surgery.